Vasculitis, a complex and often misunderstood disease, represents a hidden battle raging within the body. This invisible enemy targets the intricate network of blood vessels, the vital pathways that carry oxygen and nutrients to every cell. Imagine a vast system of roads and highways suddenly under attack, disrupting the smooth flow of traffic and isolating entire communities. This is the challenge posed by vasculitis, a disease that can affect anyone, regardless of age, gender, or ethnicity. Vasculitis is not a single disease, but rather a group of disorders characterized by inflammation of the blood vessels. This inflammation, a natural response to injury or infection, becomes misdirected in vasculitis, causing the body's own immune system to attack the walls of its blood vessels. The consequences can be devastating, leading to a wide range of symptoms and potentially life-threatening complications. Understanding vasculitis requires unraveling the complexities of the immune system and its intricate relationship with the circulatory system. It demands a closer look at the different types of vasculitis, the factors that increase a person's risk, and the challenges of diagnosis and treatment. This video information aims to shed light on this often invisible enemy, empowering individuals with knowledge and hope in the face of this complex disease. To comprehend the impact of vasculitis, we must first appreciate the critical role blood vessels play in maintaining our health. These intricate pathways, ranging in size from major arteries to tiny capillaries, act as the body's transportation network, delivering oxygen-rich blood and essential nutrients to every cell while removing waste products. When vasculitis strikes, this intricate system comes under siege. Imagine a garden hose slowly being squeezed shut. The flow of water diminishes, and eventually the plants wither and die from lack of nourishment. Similarly, when the walls of blood vessels become inflamed, they narrow, restricting blood flow to vital organs and tissues. This restriction, known as ischemia, can lead to a cascade of problems, from tissue damage and organ dysfunction to life-threatening complications. The severity of vasculitis depends on the size and location of the affected blood vessels. Large vessel vasculitis, as the name suggests, affects the larger arteries, such as the aorta and its branches. Medium-sized vessel vasculitis targets arteries that supply blood to organs like the kidneys, intestines, and brain. Small vessel vasculitis affects the tiny capillaries and arterioles, disrupting blood flow to the skin, nerves, and joints. The consequences of this vascular siege are far-reaching. Organs starved of oxygen and nutrients begin to malfunction. Tissues may die, leading to permanent damage. The body's ability to heal and fight infection is compromised, leaving individuals vulnerable to a host of complications. Understanding how vasculitis affects blood vessels is crucial to grasping the seriousness of this often invisible enemy. The human body possesses a remarkable defense system, the immune system, which constantly patrols for and neutralizes threats like viruses, bacteria, and other foreign invaders. This complex network of cells and proteins acts as our internal army, protecting us from harm. However, in autoimmune diseases like vasculitis, this normally protective force turns against the body it is meant to defend. Imagine a loyal guard dog suddenly attacking its owner. This betrayal, though tragic, illustrates the essence of autoimmunity. In vasculitis, the immune system misidentifies the body's own blood vessels as foreign invaders, unleashing an attack on these vital structures. This misguided assault leads to inflammation, damage, and the disruption of blood flow that characterizes the disease. The exact reasons for this immune system malfunction remain a mystery, but researchers believe a combination of genetic predisposition and environmental triggers may play a role. Certain individuals may possess genes that make them more susceptible to developing autoimmune diseases. Exposure to certain infections, medications, or toxins may then trigger the immune system to turn against the body. This autoimmune aspect of vasculitis poses significant challenges for both diagnosis and treatment. Unlike infections, which can be targeted with antibiotics, or injuries, which can heal over time, controlling autoimmunity requires suppressing the body's own defenses. This delicate balancing act aims to quiet the immune system's attack on blood vessels without leaving the individual vulnerable to other infections. Vasculitis is not a monolithic disease, but rather a diverse group of disorders, each with its own set of characteristics, affected blood vessels, and potential complications. Understanding these distinctions is crucial for accurate diagnosis and tailored treatment plans. While a comprehensive discussion of every type of vasculitis is beyond the scope of this video, we will briefly explore some of the most common forms. Giant cell arteritis, also known as temporal arteritis, primarily affects the large arteries in the head, neck and arms, particularly the temporal arteries that run along the sides of the head. This form of vasculitis typically affects individuals over the age of 50 and can cause headaches, vision problems and jaw pain. If left untreated, it can lead to blindness. Takayasu arteritis, another large vessel vasculitis, typically affects younger individuals, primarily women under 40. This inflammatory disease targets the aorta and its branches, leading to arm weakness, dizziness, and strokes. Early diagnosis and treatment are crucial to prevent long-term complications. Polyarteritis nodosa, or PAN, affects medium-sized arteries throughout the body, leading to a wide range of symptoms depending on the affected organs. Abdominal pain, high blood pressure, muscle weakness, and skin lesions are common manifestations. Prompt diagnosis and treatment are essential to prevent organ damage. Wegener's granulomatosis, now known as granulomatosis with polyangiitis or GPA, affects both small and medium-sized blood vessels, often involving the sinuses, lungs, and kidneys. This serious condition can cause nosebleeds, sinus infections, shortness of breath, and kidney problems. These examples highlight the diversity of vasculitis and the importance of a thorough medical evaluation to determine the specific type and guide appropriate treatment. Who is at risk? Unraveling the mystery of vasculitis. Determining who will develop vasculitis remains a complex puzzle with no easy answers. This elusive disease can affect anyone regardless of age, gender, or ethnicity, making it difficult to pinpoint specific risk factors. However, research has identified certain groups who may be more susceptible to developing this autoimmune disorder. Genetics plays a role, as individuals with a family history of vasculitis or other autoimmune diseases may be at increased risk. This genetic predisposition, however, does not guarantee that a person will develop the disease, suggesting that environmental triggers also play a crucial role. Exposure to certain infections, such as hepatitis B and C, has been linked to an increased risk of vasculitis. These infections may trigger an abnormal immune response, leading the body to attack its own blood vessels. Certain medications, including antibiotics, anti-seizure drugs, and some blood pressure medications, have also been implicated as potential triggers for vasculitis. While these medications are generally safe and effective, they may cause an allergic reaction in some individuals, leading to drug-induced vasculitis. Lifestyle factors such as smoking have also been associated with an increased risk of developing certain types of vasculitis. Smoking damages blood vessels, making them more susceptible to inflammation and injury. While these risk factors provide some clues, it's important to remember that vasculitis can occur in individuals with no known risk factors. This unpredictability highlights the need for increased awareness and understanding of this often invisible enemy. Recognizing the warning signs. Symptoms of vasculitis. The symptoms of vasculitis can be as diverse as the disease itself, making early recognition a challenge. Because vasculitis affects blood vessels throughout the body, its manifestations can mimic a wide range of other conditions, leading to delays in diagnosis and treatment. However, understanding the common warning signs can empower individuals to seek medical attention promptly, potentially preventing serious complications. General symptoms such as fever, fatigue, weight loss, and muscle and joint aches are common in many types of vasculitis. These non-specific symptoms often overlap with other illnesses, making it easy to dismiss them as a passing flu or virus. Organ-specific symptoms provide more clues, pointing to the location and severity of blood vessel inflammation. Headaches, especially those that are persistent or severe, may indicate giant cell arteritis. Vision changes, including double vision, blurred vision, or even sudden vision loss, warrant immediate medical attention. Skin involvement is common in many forms of vasculitis, manifesting as rashes, ulcers, or purplish spots. Numbness, tingling, or weakness in the limbs may signal nerve damage due to reduced blood flow. Kidney involvement can lead to high blood pressure, blood in the urine, or swelling in the legs and feet. Gastrointestinal symptoms such as abdominal pain, nausea, vomiting, or blood in the stool should not be ignored. It's important to remember that these symptoms can vary greatly depending on the type and severity of vasculitis. If you experience any unusual or persistent symptoms, especially those mentioned above, consult your doctor promptly for a thorough evaluation. A cascade of consequences: vasculitis and organ damage. Left untreated, vasculitis can unleash a cascade of consequences, leading to serious and potentially life-threatening organ damage. The restricted blood flow caused by inflamed and narrowed blood vessels starves organs of oxygen and nutrients, disrupting their normal function and potentially leading to permanent damage. The kidneys, responsible for filtering waste products from the blood, are particularly vulnerable to vasculitis-related complications. When blood flow to the kidneys is compromised, waste products build up in the bloodstream, leading to a condition known as kidney failure. This life-threatening condition may require dialysis or even a kidney transplant. The heart, the engine of the circulatory system, can also suffer significant damage from vasculitis. Inflammation of the coronary arteries, the blood vessels that supply the heart muscle itself, can lead to heart attacks. Aneurysms, weakened and bulging areas in the walls of arteries, can also develop, posing a risk of rupture and life-threatening internal bleeding. The lungs, responsible for gas exchange, are not immune to the ravages of vasculitis. Inflammation of the blood vessels in the lungs can lead to shortness of breath, coughing up blood, and difficulty breathing. In severe cases, respiratory failure may occur, requiring mechanical ventilation. The nervous system, the body's control center, can also suffer significant damage from vasculitis. Inflammation of the blood vessels supplying the brain can lead to strokes, seizures, and cognitive impairment. Nerve damage in the limbs can cause numbness, tingling, weakness, and even paralysis. These examples highlight the far-reaching consequences of untreated vasculitis. Early diagnosis and treatment are crucial to preventing organ damage and improving long-term outcomes. Unmasking the culprit. Diagnosing vasculitis. Diagnosing vasculitis presents a significant challenge, as its symptoms often mimic other conditions, and there is no single test to confirm its presence. Unmasking this elusive culprit requires a combination of clinical evaluation, laboratory tests, and imaging studies to piece together the puzzle and guide appropriate treatment. A thorough medical history and physical exam are crucial first steps in the diagnostic process. Your doctor will ask about your symptoms, their duration, and any family history of autoimmune diseases. They will also perform a physical exam, checking for signs of inflammation, organ enlargement, or skin abnormalities. Blood tests play a vital role in detecting inflammation and identifying specific antibodies associated with certain types of vasculitis. Elevated levels of inflammatory markers such as C-reactive protein, CRPE, and erythrocyte sedimentation rate, ESR, suggest an overactive immune response. Specific antibody tests, such as anti-neutrophil cytoplasmic antibody, ANCA testing, can help diagnose certain vasculitis subtypes. Imaging studies provide valuable insights into the location and extent of blood vessel inflammation. Ultrasound, a non-invasive technique, can assess blood flow and detect abnormalities in larger arteries. Computed tomography, CT scans, and magnetic resonance imaging, MRI, provide detailed images of blood vessels, organs, and tissues, helping to identify areas of inflammation or damage. Biopsy, the removal of a small tissue sample for microscopic examination, remains the gold standard for diagnosing certain types of vasculitis. This procedure allows doctors to directly visualize the affected blood vessels and confirm the presence of inflammation and other characteristic features. Diagnosing vasculitis often requires a multidisciplinary approach involving collaboration among primary care physicians, rheumatologists, immunologists, and other specialists. This collaborative effort ensures a comprehensive evaluation and tailored treatment plan. Battling an invisible enemy. Key takeaways. Vasculitis, a complex and often misunderstood group of diseases, represents an invisible battle raging within the body, targeting the intricate network of blood vessels that sustain us. Understanding this elusive enemy is crucial for early detection, effective treatment, and improved long-term outcomes. Vasculitis arises from a misguided immune response, causing the body to attack its own blood vessels. This autoimmune attack leads to inflammation, narrowing of blood vessels, and reduced blood flow to vital organs and tissues. The consequences can be severe, ranging from organ damage and dysfunction to life-threatening complications. Recognizing the diverse symptoms of vasculitis is paramount, as early detection is crucial for preventing irreversible damage. If you experience persistent fever, fatigue, weight loss, headaches, vision changes, skin abnormalities, or other unusual symptoms, consult your doctor promptly. Diagnosing vasculitis requires a comprehensive approach combining clinical evaluation, laboratory tests, and imaging studies. A multidisciplinary team of healthcare professionals often collaborates to unravel the complexities of this disease and develop an individualized treatment plan. While a cure for vasculitis remains elusive, effective treatments exist to control inflammation, suppress the immune system's attack on blood vessels, and manage symptoms. Corticosteroids, immunosuppressants, and other medications help to calm the immune storm and prevent further damage. Living with vasculitis can be challenging, requiring ongoing medical care, lifestyle modifications, and emotional support. However, by understanding this invisible enemy, recognizing its warning signs, and seeking timely medical attention, individuals can navigate the complexities of this disease and live full and meaningful lives.